So today the doctor has ordered a zero point 0.5 sterile water intramuscular injection. Okay, so we've checked doctor's orders. We've got the orders. We go ahead and wash our hands. We gather our supplies. When we remove the medication from the Pyxis, we make sure, verify that it is sterile water. We check with the doctor's orders. We verify that it's correct, which it is. We go ahead and grab a 22 gauge needle, 1 inch long. Then we grab cotton balls and alcohol swabs. So we've washed our hands. We've verified our medication. We grab the alcohol swab. We go ahead and clean the top of the vial. Perfect. Take our syringe. Oh, and make sure that the expiration is correct. So it's 3/18. Medication is good. Make sure that the medication is not expired. Okay, so we go ahead and take 0.5 milliliters of air. We inject to the vial 0.5 milliliters of air, and we withdraw 0.5 milliliters. Alright. So we verify 0.5 milliliters of sterile water. Verify with another nurse. Perfect. So at this point in time, we would go ahead and change the needle. In a hospital setting, we would go ahead and change the needle before administering to the patient. So we're going to safely transport all of our supplies to the patient's room. So we knock, we wash our hands, we introduce ourselves, and then we ask the patient to identify themselves with their name of date of birth and their name. So we need them to state their name, okay, and date of birth. We verify what their name is. Perfect. We ask them if they have any allergies. They say no. Perfect. Then we go ahead and explain the procedure. So today we're going to be giving a 0.5 sterile water intramuscular injection, which can be given in the deltoid, the dorsogluteal, the ventrogluteal, and the vastus lateralis. Vastus lateralis. Alright, perfect. So today the doctor's ordered for the injection to be given in the deltoid. So we've washed our hands, we put on our gloves, and then go ahead and take our alcohol swab. Perfect. And we go ahead and clean the site. Perfect. We let that dry. Do not blow on it. Do not fan it. Just let it dry. Once we've seen that it's dried, we go ahead and verify our syringe again. So it's 0.5 milliliters of sterile water. Always want to verify before administering it. We want to verify it 3 times. We want to follow the 6 rights of medication as well, which are right dose, right time, right patient, right medication, right route, and right documentation. Alright, all 6 rights. Medication. Alright, so we've let that dry. We're going to go ahead and stabilize the muscle, and we're going to give this at a 90-degree angle. Alright, so move the cap, stabilize the muscle, give it at a 90-degree angle, and we're going to administer it slowly. Perfect. We're going to withdraw it. We're going to hold some pressure on there and apply some pressure. And normally after the medication has been administered or the injection has been given, we would throw this in the sharps. Okay, directly into the sharps. We wouldn't even recap, nothing. We would just go straight directly into the sharps. Okay, so we've applied pressure. You can apply a Band-Aid if needed. If not, perfect. We go ahead and remove our gloves, wash our hands, and then document where the injection was given, what medication was administered, how much of it was administered, and then the patient, how they reacted to the procedure. And that is all.